10 to 15% of American adults have at least 1 to 2. If you are keen on a tattoo or are on an information gathering session, like George, he thinks he'd like a full sleeve. This is how you can make the most informed decision. Here are the local and systemic complications of getting one.
It's Doctora Victoria and George.
Complications of tattoos include local infections with bacteria like Staphylococcus aureus, Mycobacterium colonae, and Pseudomonas species. Systemic complications, and this is more likely with amateur tattoo artists. Hepatitis B and C, and this is more likely with reused and inadequately sterilized needles. Generalized skin reactions, like an acquired hypersensitivity reaction, and keloid scar formation. To make a tattoo, an electromagnetic coil makes a needle oscillate, and it punctures the skin about 1 to 4 millimeters and deposits pigment that stays permanently trapped in the superficial dermal fibroblasts. Think the scaffolding of our skin. The inks are classified as cosmetics, but these tattoo pigments are considered color additives that require pre-marketing approval. The Food and Drug Administration does not have authority to require pre-marketing safety data for inks, so many complications do come from inks, but are found retrospectively or after the fact. Tattoo artists are usually licensed by local or state authorities, and it's rare to have complications when sterile equipment and infection control practices are used. When that's not done, however, localized bacterial infections can happen at that tattoo site, usually due to Staphylococcus, Mycobacterium colonae, and Pseudomonas species. As well, blood-borne pathogens like hepatitis C and B can be transmitted. Less common complications include disseminated infections with abscess formation, infectious endocarditis, and toxic shock syndrome. Non-infectious complications include a hypersensitivity reaction due to inks containing mercury, chromium, cadmium, cobalt, and iron oxide. Before getting a tattoo, I recommend making sure your hepatitis B vaccine is up to date. If you want to learn more about hepatitis B, click here. There have been outbreaks of non-tuberculosis mycobacterium outbreaks, but it's usually contaminated tattoo ink. But should this happen, it would need a skin biopsy and culture, and that can take up to 6 weeks. I hope you feel more informed about what tattoos entail. I know George certainly does, and he feels better about making a decision already. I hope you'll join us next time. Check out that video for hepatitis B, and we'll see you later to see what George gets up to next. I wonder if he'll get the tattoo. Bye-bye.